We're going to talk briefly about the Towards a Safer World initiative. That's an interagency initiative that's recently been launched. Over the past several years, an enormous amount of actors did an enormous amount of work with the benefit of a lot of investment in preparing for an influenza pandemic. And this initiative is looking to identify which of the lessons from preparing for an influenza pandemic can be useful to communities preparing for other disasters and threats now. There was a presentation that some of you may have seen at 1:15 from Liviu Vădrescu about whole of society readiness. One of the things that was identified during the pandemic preparedness effort was the importance of collaboration between civil society, the private sector, governments, NGOs, military actors to come together and collaborate in order to deliver effective preparedness. Another lesson that we found was that it's very important to build relationships between the different key actors that need to be involved in a disaster response before the disaster actually strikes. That makes the response significantly more efficient. Something that came out of the pandemic preparedness effort was the importance of identifying and then taking measures to mitigate the impact on critical services for vulnerable people, so that in the event of a major disaster, the most critical services to vulnerable people, such as health, food, water, can continue to be delivered. And the way in which that has been achieved is through a great upsurge in business continuity planning by organisations that the pandemic experience stimulated. And so many organisations now have improved their business continuity plans and made themselves more resilient to continue to deliver their key functions during a threat. David Nabarro led the United Nations System Influenza Coordination Office, and they developed some innovative, light, inclusive coordination methodologies, which David Nabarro was subsequently asked to replicate to deal with UN coordination in response to global food crises, and which coordination approaches hold some lessons for coordination to prepare for other crises. One of the major lessons that our pandemic partners have identified is that holding a variety of simulation exercises and tabletop exercises greatly benefits planning, enabling identification of flaws and gaps in plans that can be rectified, and helping to build networks and relationships amongst relevant players. The private sector, we estimate, invested about $10 billion in pandemic preparedness. And so it's interesting to look at what stimulated this gigantic investment and whether those stimuli could be replicated to encourage private sector investment in other preparedness. And we think that part of the answer is both convincing economic analyses of the cost of the threat to the private sector, coupled with scientific analysis showing that the threat really could happen. There was also some innovative seed funding mechanisms developed by UNDP and OCHA, which enabled a small amount of funding to be given to UN resident coordinators to support governments to kickstart pandemic preparedness processes. And we found that a small amount of finance can prove a huge incentive to preparedness action in low-income countries. And so I think that similar funds could be considered for preparedness for other emergencies. It's also increasingly important to be able to demonstrate results to donors and measure whether preparedness is occurring. There were several attempts to do this during the pandemic movement, one of which was by the US Center for Disease Control and Prevention, one of which was by OCHA, one of which was by ASEAN. They're all useful methodologies which help to identify to what extent countries and governments were prepared, and that helped us to identify which countries needed the most extra help, and it helped us to demonstrate to donors the effectiveness of our efforts to help countries become prepared, which reassured donors to continue to invest. There was also a huge communication effort associated with avian human influenza in the last few years, through which a lot of lessons have been learned. We made some mistakes during the start of this effort in terms of trying to encourage behavior change that didn't succeed and wasn't implemented because we didn't take sufficiently into account what was realistic, what the socio-economic and cultural factors inhibiting changes to certain behaviours amongst communities were. And so, over time, a more sophisticated approach is emerging. In the event of a severe pandemic or possibly other major disaster, essential services may, at least in the early stages, break down. And so preparedness at a household level and preparedness at a community level becomes important because families may temporarily have to fend for themselves in terms of healthcare, livelihoods, food, water. So this has led us to, including working closely with national Red Cross, Red Crescent societies, emphasize the importance of preparedness at a community level. We're planning to hold a conference on 15-16 September at the World Food Programme in Rome, Italy, where we'll bring together experts from pandemic preparedness and experts from disaster risk reduction to try to identify which of the approaches, lessons, successes and failures that we've experienced are useful and valuable for the future, and to try to identify how those can be put into action. And you can find out more about this process on our new website, www.towardsasaferworld.org. And we're obviously interested in learning new ideas from the large number of different actors and communities who've been involved in this effort over the past 5 years. So that's a kind of interactive website where new ideas and discussions, it's hoped, will emanate. I'm now going to hand the microphone to Dr. Ron Waldman, the leader of this initiative, to make some additional remarks.
Thank you very much, Michael. How much time do we have left? Sorry? That's what happens when everybody talks at the same time and says something different. 7? 6.5 now, thank you. If I keep asking you how much time. Okay, there's just a few points that I would want to stress, and some that I would like to re-emphasize that Michael has already made and that were made in the plenary session or the roundtable session yesterday. First of all, although a lot of the funding that went into pandemic preparedness came from sources that were interested in preventing a pandemic from happening, and they were interested in that because there was credible scientific evidence that a pandemic might happen. That evidence still exists, the risk still exists, and secondly, because there was evidence from prior pandemics, such as the prior influenza pandemics in addition to SARS and other biological threats, bovine spongiform encephalitis, mad cow, and so on, there was evidence that the economic consequences could be enormous. The losses to the Southeast Asian economy from SARS were counted in the billions of dollars. The GDP of Canada declined by more than 4% during the SARS epidemic. It's just really, really striking figures. At this point in time, while the risk of a pandemic continues and we're continuing to work on pandemic preparedness, we also feel that we've learned a lot from the major investments, almost $1 billion that have been made in pandemic preparedness, and we would like to now be able to substitute for the word pandemic in that phrase other kinds of disasters, no matter what they might be. We're mostly prepared to talk about disasters that are of global scope, disasters that clearly cut across all sectors of society, and disasters which require a coordinated response. But I think that a lot of the lessons we've learned can be applied to more local situations as well. Let me mention a few of the things. I think Michael touched on some, but the ones that stand out for me as I think about it today are that no matter what a disaster is, there are specific interventions that need to be made to address that particular kind of catastrophe. So we're not talking about things like, in the case of a pandemic, procurement and distribution of vaccines or distribution of antiviral drugs. The things that are applicable across the boards are the processes that we've used to promote and implement pandemic preparedness measures. It's really the processes of planning that Michael mentioned, the establishment of the relationships between people, getting different sectors to speak to each other, government, civil society, private sector, who all have a stake. Those are all things that need to be accomplished and that we know work in improving a country's overall level of preparedness. But I don't want to talk only about what can be done at a national level, because it's actually perhaps most important for many kinds of disasters to focus on households, communities, and the more peripheral levels of society. In many of these disasters, there are going to be disruptions of critical societal functions that cannot be easily replaced, and for which people themselves need to be prepared without overly relying on government services or help from other outside elements, because everyone is going to need help. Let me just say briefly that what I haven't heard at this conference yet are the notions that disasters can come in different flavors. There are some kinds of disasters, for example, that really destroy infrastructure, and we're familiar with those: earthquakes, floods, whatever they might be, tsunamis. They knock down infrastructure, take a toll in human life, but there are major reconstruction issues involved. But there are also disasters, and particularly biological ones, that don't touch infrastructure. A pandemic's not going to affect the physical infrastructure of a country. It will affect the human resources available to that country. So the relief efforts need to be oriented a little bit differently. And then there are other kinds of potential disasters that will affect the international networks, such as the financial networks that are so interwoven and interlaced these days, communications networks that can be seriously affected by some kinds of disasters, such as Y2K, for example, which we've all forgotten about because it didn't happen, but it could. So I think we have to address and tailor our responses a little bit in conjunction with the kind of damage that can be done by a disaster. These are just some of the thoughts that we have. The fact of the matter is, though, that no matter how we tailor our responses to whatever kind of specific disaster it is, the processes of being prepared for a disaster seem to be applicable across the board. And that's what we're trying to promote at this period in time, is much more than the specific technical interventions. I mentioned yesterday in the plenary, for some biological threats, it may be possible to develop a vaccine or to provide treatment to people when they're affected, but there's much, much more than that that goes into disaster preparedness, perhaps things that have been underplayed. We've talked a lot about whole-of-society approaches to disaster relief. All we're saying is that in the course of preparing for a pandemic of influenza, we've actually put some of these things into play, and we can see which ones have worked better, which ones are more difficult to accomplish, and we'd like, through the Towards a Safer World initiative, to be able to transmit those findings to the general disaster risk reduction, disaster preparedness, and disaster response communities at large. Thanks. If there's time for questions, we're happy to take them.